Good morning. We are very crowded today. First presentation will be made by me. Slow cognitive. How do CD symptoms in ADHD affect executive functions while reducing psychological flexibility is the title of my presentation. As you know, DH is a very common neurodevelopmental disorder affecting approximately 5% of children and adolescents worldwide, and is frequently accompanied by impairments in attention, impulsivity, and sometimes hyperactivity. And CDC, on the other hand, presents with symptoms. So psychological flexibility consists of 6 components: acceptance, separation, being in the moment, contextual self, values, and actions towards values. And all of the concepts are needed for flexibility to occur. So we are actually using Stroop tests when we are conducting a study. At the same time, the Stroop test was used in our study to evaluate selective attention, performance, and executive function. The Stroop test is a test that measures perceptual setup and the ability to change the response. So the aim of the study is, to the best of our knowledge, no study has yet investigated the relationship between CD, psychological flexibility, cognitive flexibility, so differences in psychological and cognitive flexibility. We have included 101 adolescents diagnosed with ADHD. And so the assessments included Barkley Child Attention Scale, Cognitive Flexibility Inventory, Psychological Flexibility Scale, and Stroop tests for executive functions. So when we come to the results, 54 participants had ADHD without CDS. 47 had ADHD with CDS. Sociodemographic findings showed no significant difference, only father's age. Psychological flexibility, when we look at it, the total psychological flexibility scores were significantly lower in the ADHD plus CDS group. So the subdimensions showed no significant differences. And cognitive flexibility, ADHD plus CDC group showed lower cognitive flexibility scores, but this was not statistically significant. And as a result of the Stroop test, ADHD plus CDS group was a little less important and less difficult, but there has been some differences. Here are the tables. So our findings suggest that the psychological flexibility is notably reduced in adolescents with both ADHD and CDS, given that most prior research focuses on adults, and the psychological flexibility in adolescents is largely understudied. Our work highlights a critical area for early intervention. When the literature was examined in terms of executive functions, it was observed that different results emerged. Cognitive flexibility and executive functions are somewhat lower in this group, though not significantly. This aligns with the previous literature suggesting executive dysfunction and slower cognitive processing in individuals with CDS. So for the clinical implications, what can we say? So for the considering CDS symptoms and ADHD management is important. Interventions, more important, suitable interventions, psychological flexibility, and also the executive function training is important in this sense. So there are different neuro disorders, CDS, and therefore further research would be suggested. Cross-sectional design is one of the limitations. Limited sample size is another limitation. Lack of a healthy control group and subjective parent reports for CDS symptoms would be another limitation. So limited validated adolescent tools for psychological flexibility in Turkish. So this was not used in Turkey. And both for psychological, first study examining both psychological and cognitive flexibility in adolescents with ADHD was an importance of the strength of the study. So thank you. This was a very short presentation. Now, Mehmet Donbaloğlu, the floor is yours for your presentation, please. I would like to say hello to everyone. My presentation is titled An Eye Tracking Study, Comparison of Neuropsychological Profiles and Reading Performance of Children with ADHD and Dyslexia. ADHD and dyslexia are among the most psychiatric disorders in childhood. Both disorders can negatively affect cognitive functions. It is critical that the diagnosis and differential diagnosis of these disorders are made accurately and objectively in order to plan individualized interventions. In this study, the objective is to map the neuropsychological profiles and reading performances. There is this CNSVC neurocognitive test battery and working memory scores are important in this sense and used, which are frequently associated with reading and map their neuropsychological profiles. And CNS, I'm going to abbreviate it as a CNS, the Central Nervous System Vital Signs, is a computerized neurocognitive test battery that allows for millisecond precise measurement and assessment of important cognitive functions through neurocognitive tests. This means the mean of standard scores is 100 and higher scores indicate better performance. This is how it looks like. This can be used. The participant can receive information. The tests including this process, Stroop tests, verbal memory, visual memory, processing speeds, executive function, simple attention. So these are the tests. Are looking for a neurocognitive index, verbal memory, visual memory, finger tapping, symbol digit coding, Stroop tests. So eye tracking refers to the process of measuring where we are looking, also known as the fixation point of gaze patterns. And eye tracker records the position and movements of the eyes during these measurements. You can see on this slide, there is a reflection that is caught by the camera, so the look of the eye can be tracked. During the reading, the eye movements and fixation, the saccades. Saccades are actually between two points, the transfer of the movements. Means the saccade. So a total of 78 children between the ages of 8 to 12 years, including 26 children with ADHD, 26 children with dyslexia, and 26 children with typical development were enrolled in the study. The WISCR intelligence test was applied to all participants, and those with an IQ score greater than 80 were included in the study. Participants had no past or current use of psychotic medications. Care was taken to ensure that there was no comorbidity in the selection of ADHD and dyslexia cases. I can pass the slide. So here you can see the CNS results. As expected, neurocognitive and composite memory, verbal memory, visual memory, the ADHD was reduced from. There were some differences concerning the composite memory. In the DHB was not different compared to the control group. This actually was resulting from the visual memory, and DHB visual memory was not different than the control group, means that the visual materials were preferred. That is the reason why these kids can have a greater academic development. When we look at the eye tracking results, fixation and saccades were evaluated. I can summarize it as in the DHB group, did not show any difference, significant difference compared to the control group. But in the dyslexia group, also differs from the two other groups. Dyslexia group for the fixation time, fixation, saccade numbers, saccade timing was different compared to the healthy group. Again, for the reading group were also different compared to the DHB. So here is the areas of interest. Here are the eye trackings of the healthy group. These little circles are the fixations, and in the intervals are the saccades. The ADHD group is a similar pattern you can see, and dyslexia looks like this. There's a lot of fixations and saccades, as you can see on the slide. So as a conclusion, our study supports the view that ADHD and dyslexia cause significant impairment in various cognitive domains and shows that the eye movements of children with dyslexia during reading objectively reflect the difficulties they experience during reading. So the eye tracking movements in dyslexia has a potential to be a component, an important component in that sense. So this was my presentation. Thank you very much. For the next presentation, I would like to invite Ms. Hande. The floor is yours, please.
Evet, merhaba.
Hello everyone, good morning. And today I'll be talking to you about the attention deficit and investigation of the relationship between sleep disturbances, chronotype functionality in the restrictive ADHD. And first of all, I'll be talking about the attention deficit and hyperactivity. These are characterized by lack of motivation. These are one of the most common neuro development deficiency of the childhood age. The attention deficit hyperactivity disorder is one of the most common neurodevelopment disorders of childhood, characterized by developmentally inappropriate symptoms of inattention, hyperactivity, and impulsivity. Over the years, the symptom clusters of this disorder have been categorized into three subtypes: predominantly inattentive presentations of ADHD, predominantly hyperactive impulsive presentation, and combined presentation. And the concept of restrictive ADHD phenotype is based on the certain hypothesis. So, on the other hand, the sleep problems in children with ADHD have been linked to increased behavioral difficulties, diminished cognitive functioning, and reduced overall quality of life. And prior studies have linked heightened eveningness with inattention symptoms. This study aimed to compare chronotypic characteristics and sleep disturbances between ADHD-R and ADHD-PI groups and to examine their impact on functional impairment. And so, what methods we used in our study? First of all, the study sample included 104 children aged 7 to 12 years old with no comorbid psychiatric diagnosis, excluding ODD and CD, and no psychotropic medication use in the last 3 months. The sample consisted of 34 children with ADHD-PI, 36 with ADHD-R, and 34 typically developing peers. The parents completed the children's sleep habits questionnaire, children's Chronotype questionnaire, with functional impairment rating scale parent form, and the Berkeley Child Attention Scale. The participants were evaluated as such. Here are all the results, and No statistically significant differences were found among the groups regarding age, height, weight, maternal age, or paternal age. However, maternal and paternal education levels differed significantly between the groups. The functional impairment was observed in 67 of the ADHD PI group and 61 of the ADHD R group, both significantly higher than the control group. And here you see that no statistically significant differences were observed among the groups in terms of chronotype, preference, and prevalence of sleep disturbances. And participants with a total CSHQ score over 41 were considered to have sleep disturbances. Sleep disturbances were observed in 67% of the ADHD PI group, 66% of the ADHD R group, and 44% of the healthy controls. And although this difference was not statistically significant, the higher rates were observed. And in the ADHD PI group, comparisons between participants with and without functional impairment revealed that those with impairment had significantly higher scores in sleep duration on free days and sleep disordered breathing, according to the CHSQ subscales. However, binary logistic regression analysis showed that these variables did not significantly predict functional impairment. And in the ADHD R group, children with functional impairment exhibited higher levels of sleep disturbance, more parasomnias, more pronounced inattention and oppositional symptoms, and higher SCT scores. However, these variables did not independently predict functional impairment in regression analysis. And here are the results. Functional impairment was observed in 67 of the ADHD PI group and 61% of the ADHD R group, both significantly higher than the control group. In the ADHD R group, increased eveningness scores were significantly associated with impairment school functioning. Both ADHD R and ADHD PI groups exhibited significantly greater daytime sleepiness compared to the controls. Among children with ADHD-PI, these with functional impairment had significantly later sleep onset times on free days and higher scores in parasomnia and sleep-disordered breathing. And in the ADHD-R group, children with functional impairment showed significantly higher scores in overall sleep disturbance, sleep duration. In the discussion part, this study is the first to assess functional impairment in the ADHD-PR phenotype. It investigated chronotype and sleep disturbances in children with ADHD-PI, both with and without hyperactivity symptoms, demonstrated their associations with functional outcomes. In both groups, increased parasomnia and longer sleep duration were related to greater functional impairment. Methodological strengths of the study include a homogeneous clinical sample, exclusion of psychiatric and medical comorbidities, inclusion of medication-naive participants, inclusion of low IQ, and comparison with a typically developing control group. A key limitation is the absence of objective sleep assessment tools. Addressing sleep disturbances is essential for improving quality of life and daily functioning in children with ADHD, particularly in the ADHD-PI subgroup, where pharmacological and non-pharmacological treatments may be insufficient. Parasomnias and sleep duration should be thoroughly assessed, and interventions aimed at improving sleep hygiene and reducing sleep disturbances hold promise for enhancing overall functioning in children with ADHD. Thank you. Another presentation will be made by Dr. Esma Ayda. She is not present here. İrem Damla Çimen is invited to the floor. Good morning, everyone. I am İrem Damla Çimen, coming from Kocaeli University. Today I'll be talking about a study we conducted with our assistant. This is about the pharmacological treatment of preschool ADHD, a 12-year-old retrospective study on efficacy and side effects. And as we know, attention deficit hyperactivity disorder is a neuropsychiatric disorder that begins in childhood and characterized by symptoms of inattention, hyperactivity, and impulsivity, which are inconsistent with the individual's age and developmental level. The American Academy of Pediatricians recommends that children aged 4 to 18 who have academic or behavioral issues and exhibit symptoms of inattention, hyperactivity, or impulsivity should be evaluated for ADHD. Epidemiological studies show that the prevalence of preschool ADHD varies between 2 to 7%. In scale-based studies, this prevalence is 18%, while it drops to 7%. And in the literature, ADHD studies have mostly focused on school age and adolescent periods. The publications on preschool ADHD are limited, and the aim of study was to determine the drug treatments applied to patients who applied to our outpatient clinic during preschool age and were diagnosed with ADHD, and compare patients who used and did not use medication in terms of symptom severity and characteristics such as age and gender, and also to evaluate the efficacy and side effect levels of the drugs. Additionally, the study aims to increase the awareness. In the study, the file data of the 412 patients who visited the child and adolescent psychiatry outpatient clinics of Kocaeli University Faculty of Medicine between 2012 and 2024, who were under the age of 6 and diagnosed with ADHD, were retrospectively analyzed. And from the files, I showed out demographic information, treatment methods, and the effect and side effect status of the medications, as well as the severity of the side effects were collected. The clinical global impression scale and general assessment scale of all children were relied upon. And the group and drug therapy characteristics can be summarized as follows. It was found that 212 out of 412 patients, which corresponds to 51.5%, started drug treatment. Most of the children who started taking medication were male and age 4 to 6 years. There was no significance in gender and age between children who were started on medication and those who were not. The most commonly prescribed medication was antipsychotics, children using at least one type of antipsychotic. Guanfacine was the least used drug, which only 3 children received it. There was no significant difference in drug preference according to gender and age among children who started taking medication. The rate of starting medication was a little bit low. In the group started medication treatment, the initial CGI score was found to be significantly higher, and CGAS score was found to be significantly lower compared to the group that did not start medication. According to the test results, there was a statistically significant difference between pre and post treatment CGI and CGAS scores in both groups. However, the change in CGI and CGAS scores were found to be greater in the 4 to 6 age group compared to the 0 to 3 age group. A statistically significant improvement in the CGI scores were observed in both female and male participants following treatment compared to before treatment. And the table 1 shows the comparison of CGI and CGAS scores in children who started drug treatment. Looking to the drugs, we see that in all the drugs, CGI and CGA scores varies, and CGAS score has significant difference. However, what stands out is that the methylphenidate group before the treatment, CGAS score was a little bit high. Its functionality is the group's functionality was higher. For atomoxetine, after the treatment, there was no significant difference in terms of the GAS level for the groups. For the other groups who received other drugs. What about the side effects? Side effects related to the medication use were reported in 24.6% of children who started taking medication. When the CGI side effect severity was examined, it was observed that children had side effects with a severity of functionality not significantly affected, and no more severe side effects were reported. When examining the side effect status according to gender and age for each drug group individually, no significant difference was found. The most common side effects in APs were symptoms such as headache and dizziness, and the difference was found to be significant. In conclusion, according to the results, all three drug groups are effective in reducing clinical symptoms and improving functionality in children with Preschool ADHD, and it will be beneficial to start drug treatment if psychological approaches are not beneficial when ADHD is diagnosed in this age group. When the study results were examined, it was determined that the severity of side effects due to drug use was low. MHP may be the first choice because in the study, CGIS value after AP treatment was lower from the other group of and side effects of headache dizziness were found to be significant, and CGAS score after treatment with ATX was similar to scores of the other group. Studies to be conducted in this area will guide the selection of the most appropriate drugs in terms of efficacy and side effects in this age group, and the determination of which side effects should be paid more attention to during drug use. Early identification and treatment are essential to prevent associated cognitive, psychological, and developmental impairments that may arise in later stages. Early diagnosis and treatment it will prevent the psychological and sociological problems that may develop in the future. Thank you. Hello everyone, I'll be talking today about attention deficit disorder and hyperactivity disorder diagnosed children's parents, the perceived social support, merit, satisfaction, problems of the parents. Our purpose in this study is the
ve yaşama kaliteleri düzeyleri belirleme ilişkili faktörleri araştırmaya başladı. Araştırmamızda 6-18 yaş aralığında
So, in this study, 80 parents of children diagnosed with attention deficits and hyperactivity were included. Inclusion criteria for the study was being between 1.6 and 18 years old. Between 6 and 18 years old, and having been diagnosed with attention deficit hyperactivity disorder according to DSM-5 diagnostic criteria. So the exclusion criteria from the study says that under 6 years old and over 18 years old, presence of other additional disorders such as mental retardation or organic disorders. Demographic data from World Health Organization Quality of Life Scales, Marital Satisfaction Scale, Multidimensional Scale of Perceived Social Support, and DSM-4 based diagnostics. So of the parents participating in this study, 80% were mothers, 75% of the children were boys, and the median age of all children was 8.53, and the median age of mothers was 36 years. 53.75% of mothers and 48.75% of fathers had secondary school education or below. 35.3% of families reported income levels below the minimum wage. So, in our study, the relationships among perceived social support, marital satisfaction, and quality of life, severity of attention deficit and hyperactivity disorder, child age, parental education status, and family monthly income levels were examined. In our study, perceived social support, marital satisfaction, and quality of life were found to be negatively correlated with the severity of attention deficit and hyperactivity disorder and the age of the child. It was found to be positively correlated with the father's education level and monthly income level. In our study investigating the quality of life, perceived social support, marital satisfaction, and factors affecting the quality of parental life and parents of children diagnosed with attention deficit and hyperactivity disorder, variables such as high ADHD severity, low monthly income, older age of the child, and low level of education of the father were found to be factors that negatively affect the quality of life and mental health of the parents. In our study, again, our study suggests that factors such as ADHD severity, the child's age, the family's income level, and the father's education level may be factors affecting parental quality of life, marital relationships, and mental health. In addition to intervention for children, planning programs to improve parents' coping skills can increase parental quality of life and improve mental health. I would like to thank you to all. We would like to thank you. So our next presentation is going to be done by Gizem Buket, but I think she's not here. Okay, for our last presentation, Yaren Özgü Akın Soyupek, the floor is yours, please. Hello, I am coming from Ankara Bilkent Şehir Hospital. I would like to talk about the effect of emotion regulation difficulties on the treatment of internalizing disorders in adolescents. So we had a study. The aim of our study is the adolescents who experience internalization problems often also struggle with emotion regulation difficulties. So similarly, parents of adolescents with emotion regulation difficulties are also found to have challenges in regulating their emotions. So the literature says there were no studies in that regard. So when we were actually planifying our study with regards to the disorders in this sense, regulation disorders, this includes, for instance, difficulties. This includes observation, parenting practices, emotional climate of the family actually had effects on emotional regulation and adjustment for the kids, and also the behaviors of the parents is important. So during the sample of the study, it consists of adolescents aged 12-18 who were hospitalized due to internalizing disorders and their parents between the dates of March 20, 2024 and November 15, 2024 in the child psychiatry inpatient unit of Ankara Bilkent City Hospital. So 70 patients with 5 treatment. Inclusion criteria for adolescents were actually being between the ages of 12-18. Anxiety disorders, depressive disorders, dissociative disorders, or eating disorders. These patients were included in the study. So we were actually received volunteering for participation in the study from themselves and from their parents. So parental consent as well. So internalizing problems being also prominent according to the strengths and difficulties questionnaire during hospitalization. So being younger than 12 years old than 18 years old and have again volunteering to participate in the study was the only condition, and also having a mental capacity and having diagnosis of psychotic disorders, bipolar disorder, autism spectrum was out of the needed conditions. So for the data collection tools, treatment response during admission and discharge was evaluated by clinicians using the clinical global impressions scale. Parents completed a sociodemographic data form, and the children's depression inventory also, and the strengths and difficulties questionnaire were also completed, and also child anxiety related disorders, so scared was also completed, and difficulties in emotion regulation scale, so the DERS also used to assess emotion regulation difficulties. So for the statistical analysis, we actually, in the study, the analysis of the obtained data was performed using descriptive and comparative statistics with the R software. Here you can see the correlations, but of course I'm not going to go through all of them. Maybe on this slide we can pursue. So there are some relationships between the parental's unsupportive attitude and parental emotion regulation difficulties. And we actually look at the literature. There can be some reasons beyond that, but first, we actually collected information from themselves, and also there was some changes between the information that we receive from the parent and the child. So there is in the literature that says that there's a lacking point between the two parties. So there are some great correlation. Here is 99 is the total relationship. Is actually showing us that parental emotional regulation difficulties has an effect on the children's having emotional regulation difficulties. So what is important for us is the parental supportive attitude has an effect. So the parents, when the kid is hospitalized, should be more supportive. When this is the case, so the adolescents in hospitalized can receive more benefit for the time period that they are hospitalized. So when we look at the results, the parents' difficulties in emotional regulation increase negative parenting attitudes, and as adolescents' difficulties in emotional regulation increase, internalizing problems also increase. And parents' difficulties in emotional regulation indirectly affect children's internalizing problems. And positive parenting attitudes contribute positively to adolescents' psychiatric inpatient treatments. So, as a suggestion, it is believed that providing education programs to the parents of patients receiving treatment in psychiatric inpatient units aimed at developing supporting parenting attitudes could contribute to positive progress in the patient's treatment processes. And in future studies in this area, it is recommended that emotional regulation difficulties and parenting attitudes be assessed by different sources of information, that emotional regulation difficulties be measured not only through questionnaires, but also with alternative research methods, and that treatment outcomes be examined not only through changes in symptom severity, but also through different parameters. Thank you very much. So I actually learned that I was participating in this session. I'm sorry for that. Of course, I will control everything else because there are some evaluations that are needed. So thank you very much. But there's a very low participation in the previous congresses. I saw that there was a lot of participation, but slowly, I think the research, the intention, the curiosity for research actually is decreasing, or what? Normally, for a post for a presentation, there was 8 and 7 minutes that were consecrated for each presentation, but in 40 minutes we are at the end of everything, I guess. So thank you very much.